you, Andy, and thank you, APEC, for the opportunity of coming to allow us to come and present the findings of our James Lind Alliance priority setting partnership looking at the treatment of blood pressure in pregnancy. So, James Lind was thought to be one of the first clinical trialists. He conducted what is thought to be one of the first randomized control trials, with the intervention being citrus fruit for the treatment of scurvy. So his name has then been used to sort of set up this initiative, this priority setting initiative, which is meant to bring together patients, or in our case, women, not so much carers, rather relatives, partners, and healthcare workers together in order to identify uncertainties within an area. In our case, that was the high blood pressure in pregnancy, to identify uncertainties and to jointly prioritise which uncertainties need to be addressed. So we started by forming a steering group. As you can see, many familiar faces here. And in particular, I wanted to highlight Dr. Ali Ho, who unfortunately wasn't able to give her talk for last, but she did the lion's share of the work for this project. So I just wanted to give a mention to her, but thanks to all the rest of the steering group also. Within this group, we agreed what was going to be out of scope for this project. We set up a website which is still active now, so if you please do go ahead and have a look at it if you have time or wish to, and we use this platform in order to be able to host the surveys that formed the methodology aspect of this study. So the Jla methodology is relatively prescriptive. You start with an initial survey that we were very grateful to APEC for publishing through their newsletter, and we also promoted through social media. That then led to identification of 50 summary questions, which were included in the interim survey, again promoted, sent out to women, healthcare workers, etc., for review, to then reprioritise and identify the final 25 questions, which went forward to a face-to-face meeting, a prioritisation workshop, to identify the top 10. So our initial questionnaire, we very much felt that we wanted to be as open as possible. So we could have been slightly more prescriptive, we could have been more direct in terms of trying to tease out questions, but actually we felt that the approach should be that whatever questions people felt they wanted answered were brought to our attention. So we were very open-ended in our initial survey, and we were really pleased to have 278 responders, and even more pleased that over half of those were women. So we had a 64% response rate from women with lived experience of hypertensive disorders of pregnancy. Additionally to that, we had 26% of healthcare professionals and 3% of partners and relatives. This led us to the mammoth task of having 764 questions that we then had to, Ali and I had to thematically analyse, and for that we came up with 9 themes, and these included mechanistic questions, prediction questions, prenatal management, antenatal management, postnatal management, maternal outcomes, perinatal and child outcomes, and then a separate group that we initially hadn't anticipated, which was that there were a lot of questions where we do already have answers, but that women and partners were telling us that the information that we have as clinicians and healthcare workers perhaps isn't out there in the forum. And so that's something we're very much taking forward with APEC in terms of making sure that the up-to-date information is out there for women and their families who have experienced hypertensive disorders of pregnancy. And then finally, we had a category which is very much out of scope, and you'll see the type of question that potentially went into there in a moment. We sorted our questions, and questions could go into more than one theme where we felt that that was relevant. These were all then brought to the steering group, who distilled these into 50 summary questions. Examples of questions included: what is the risk to long-term health and what monitoring do these women need post-pregnancy? What are the causes of high blood pressure in pregnancy? And then perhaps slightly potentially out of scope, a statement labouring in water can reduce blood pressure as it stimulates the release of atrionatriuretic peptide, which effectively reduces blood pressure. This can be done safely with close supervision and has great effect. However, within that, we did make sure that we teased out a question that could be considered by the panel in terms of atrionatriuretic peptide and water birth in terms of blood pressure reduction. Our 50 questions were then put out again to be sorted into summary questions further and distilled into the priorities to those who'd already answered the questionnaire, as well as through APEC. And what we encouraged those who participated to do was to identify all of the questions they thought were important into category 1, and then from those choose their top 10, and then from those, in order to give a weighting to allow us to identify that final 25, we again asked individuals to categorise their top 3. The interim survey had 155 responders. Again, we were really pleased that we had a 55% response rate from women with lived experience. And here are the top 25 questions that were brought forward to our final prioritisation workshop. For this workshop, we put out an invitation to all of those who'd participated in the first and second survey and provided their information. So we had a balance of those with lived experience, partners and family members of those with lived experience, and healthcare practitioners who all attended. We had 29 attendees in total to the face-to-face final prioritisation workshop, which you can see from this photo was before COVID. And steering group members, as you can see from this photo, were present also, but were very much only there in order to oversee the process and were not part of deciding the top 10. So what are our top 10? Number 1, what are the long-term physical and mental health consequences of pregnancy hypertension for women, babies, and their families? How can we predict and prevent shorter-term complications of pregnancy hypertension? What is the best screening test for pre-eclampsia? Following pregnancy hypertension, what is the best way to prevent future long-term problems? What is the cause of pregnancy hypertension? How can pregnancy hypertension be prevented in a subsequent pregnancy? I thought this one was particularly interesting as hadn't been able to predict it, but what are the educational needs of healthcare professionals managing women with pregnancy hypertension? What is the best way to diagnose pre-eclampsia promptly? What is the best way to manage pregnancy hypertension? And finally, how can we provide better support for women with pregnancy hypertension and their families? From these top 10 questions, we distilled these into headline summaries so that these could be brought to the attention of the major funding bodies in order that these research questions are hopefully answered by research moving forward. And you can see these here. I'm pleased to say that we have been able to publish these research findings. So if you would like to read more, please do go to BMJ Open. And finally, I'd like to say a really big thank you to all the women, their family members, together with the healthcare professionals who made this priority setting partnership possible. And a big thank you to the steering group committee members. Thank you.
Great, thanks very much, Louise. You've used up all your time, and at the moment there are no questions, but do come back to the question and answers and answer anything that people might want to ask post hoc. And actually, the James Lind Alliance is phenomenal in terms of influencing funders. So well done, everybody, in doing all that work, because it will make a difference in the coming years to what funders will look at. And you do get some surprises, don't you?